It's
Interesting indeed.
between that AT&T outage last week.
Yeah, that you know what's funny about that is that's who I use. I use AT&T, and I don't know.
Were
I
you
never.
out?
No, I didn't. If it was out, I didn't notice it.
So
Um,
my staff was freaking out. And they were like, "Hey, what are we gonna do? AT&T is out." And I was like, "Well, you're calling me on a voice over internet line from the office. It's AT&T, but apparently it was cell
something about it.
problems, not line problems, because all the lines are run by the local monopolies, you know.
Something
So
about it was putting the phone in SOS mode or something. I don't know.
yeah, that was a whole nother
I
mess with.
uh I saw that obviously people were. I had friends that had AT&T, and a couple of them said it happened to them, but I never noticed it on my device, so I'm not sure. But
Yeah.
hey, Leanne, hey, hope you're doing well. Glad to see that you're back. Hope everything's good.
Hope you're
So
staying out of trouble.
yeah, Leanne, hope you're staying out of trouble as always. But we'll go ahead and dive into it, guys. Obviously, for those that are just joining in with us for the first time, we like to do a little trivia based off last week's presentation, which if you weren't on last week's presentation, we were talking about human resources and medical compliance and essentially tying the two together. So I'm gonna go ahead and share screen, and we'll go ahead and hit this trivia question. See, get the brain juices flowing. Let me know if you can see, Jose. Might take a second. Let me know when you
Yep,
got
you're
it.
good.
Awesome. So, trivia question for today is which regulatory body is responsible for overseeing compliance with the Health Insurance Portability and Accountability Act? And the choices today are A, Department of Health and Human Services, B, Food and Drug Administration, C,
Ooh.
Centers for Medicare and Medicaid Services, or D, Office of Civil Rights.
I see what you did there.
So, guys, go ahead and throw your answers in chat. We'll give it about 30 seconds here, and let's see where everybody's at. Don't be shy. Put your answer in chat.
No pressure. We're only going to judge you.
Jose, this is a judgment-free webinar.
I didn't agree to those rules.
Leanne, where you at? Put your answer in chat.
You know you did this trick question thing again, right? Did you
I hope
know that you did this trick
maybe
question
you can
thing
bail me
again?
out because I had an answer in mind, but maybe I did make it tricky.
Well, yeah, we'll go with your answer, but there's some clarification.
All right, so we got one answer in here. Thanks, Leanne. Appreciate it. But which regulatory body is responsible for overseeing compliance with the Health Insurance Portability and Accountability Act? A, Department of Health and Human Services, B, Food and Drug Administration, C, Centers for Medicare and Medicaid Services, or D, Office of Civil Rights? Ray's answer was A, Department of Health and Human Services.
Yeah, CMS and
But
OCR are part of HHS, and
yes,
OCR's enforcement arm for HHS.
but HHS is the primary entity. So
Agreed.
there's
It is the most broad entity. Yes. Yes. That's why I said I was like, "Oh, you're gonna go
I
do
should have
this."
made it
Okay.
a I should have made it a A and D.
There's no problem with what you did. I was just saying, like, hey, look, they technically, if we wanted to
No,
be
you're
biblical,
right. I was going for this. I was going for primary entity, which is Health and Human Services Department. But anyways,
I mean, it's the cabinet level position. So yeah,
it is.
that makes sense.
It is. So thank you guys for participating. We'll go ahead and dive into the presentation. Give me just a moment and let me pull it up.
It's been a while since you did that, right?
What, threw a trick out there?
Yeah, through the well.
Maybe that's why maybe that's why our audience was confused to answer. They didn't want
We're
to.
like, wait a minute.
But
We're going for most correct.
yeah. All right, let's get it going. So
Yep, yep.
uh everyone, thank you for joining us for another episode of today's compliance step-by-step webinar. Today, our primary topic today is going to be around enhancing healthcare compliance, leveraging resources. I'm Ray Walters. I will be your host for today's session. I'm also joined by my co-host and special guest, Jose Delgado. And just a brief
Going.
background of Jose. And Jose, feel free to chime in as always. Jose has over
Doing good at it.
17 years of healthcare experience and consulting. Um, Also owns a mental telehealth clinic as well. And how long have you been in that, Jose? I would say what,
And
3 or 4 years
mental
now?
health since the era before COVID, you know?
There you go.
So
So Jose has a lot of experience in the healthcare realm. So glad to have him on here. Um, Jose also, well, let me mention this. One of these, we host a in-person event. We call it EPIConfluences, and obviously Jose has been a part of this conference since the beginning, which was what, 2013, 2014 is when we had
something
our
like that.
somewhere around that era. And within this conference, we hosted around healthcare innovation and compliance, and there is a program that we have. Trained healthcare administrators, healthcare professional students on, and we call it our HIPAA security officer training program. And it's a program that's going to give you a very deeper understanding of HIPAA and how to leverage it at your whether you're a practice owner, you're the compliance officer, etc. And this is a course again that we're currently offering at our in-person events. We might even have a few people on here that have taken this course at one of our in-person events. Um, and again, for those that are just tuning in, this is a course that we will be offering very soon in an online format as well. So we're very excited about that. We will be sending out some information once we get a more solidified deadline, but we're really looking to push to have this up by the end of April is what it's looking like. So stay tuned. We'll be sending you guys some more information on that. Jose, I didn't know if you wanted to add anything to that security
Yeah, I
HIPAA security
mean,
officer training
the
as well.
CHSO is basically a conference that we did in person for quite some time. I don't know if we're looking to resume it here next year, or if we're gonna just do it all virtual now. But the CHSO is 8 hours in a boot camp style. Then you take a test, you pass it, you get a cert. You don't pass it, you don't get a cert. So it's pretty basic in that respect. If you have a familiarity with HIPAA security, it definitely makes life easier. If you're not, and this is your first foray into healthcare, it can be a little bit intimidating just because of how all-encompassing HIPAA security can be, but we try to make it pretty attainable. And so, if you got any questions or concerns, definitely feel free to reach out to either Ray or myself, and we can go into more details.
No, absolutely. Appreciate it, Jose. And so let's sort of dive into it. For those of you that are just joining in, maybe perhaps missed last week's webinar, we had Jose and myself. We interviewed Leah Hebert, who is a good friend of ours. She works in the human resources side of things, and obviously our subject of discussion last week was sort of talking about how compliance and HR sort of go hand in hand. So you can call this a little bit of a spin-off from that topic, but one of the things that Leah had talked about was the OIG exclusions and how you sort of on the HR side of things use that to sort of conduct background checks of your employees. And I wanted to sort of talk a little bit about that. And obviously, Jose, obviously get your insights as well.
Absolutely.
But as far as the exclusions go, where do you go, or how can how can our audience learn more about exclusions and what exactly does that entail?
So the trick of it is, right, do we have processes in place for when we hire somebody new? And depending on the kind of environment that we're in for healthcare, we want to make sure that we're hitting certain um, signposts as we go through the process of onboarding a new employee, right? So, yeah, exactly. So Leanne's put it in there. Yeah. So you got to do a background check, and the thing is, the background check, if you just do a criminal one, it may not necessarily bring up any of the civil problems that may be in your future employee's background. Some of those could be like, hey, they got caught out of practice that was convicted of Medicare fraud or found to be doing something against an HHS guideline. And so they're blacklisted. So if you have someone who is employed by your practice that is blacklisted on the OIG website, you cannot participate in a federal program. Any program that is part of the federal government receiving funds. I mean, you're talking Medicare is the most obvious one, but you can just go down the list and you'd be shocked by how many programs there really are that affect us in the healthcare space. I mean, you could even go down to some spaces where they're accepting chip, and all of a sudden, boom, you're screwed. That person can't work there. So it's really important that not only do we prevent, do we know if employees are working or have an issue like that before they start working with us, but also that we maintain our own integrity so we don't get on that list. Because once you're on that list, I mean, it's a scarlet letter.
Right. It's kind of like the OCR audit.
It is. It's on the. It's
Yeah.
the. Yeah. It's bad. It's real bad. So,
What are
but
some
this is
examples of offenses? I'm just curious.
so. I mean, it could be anything from, like I said, Medicare fraud,
Hmm.
to even DEA issues. I've seen some DEA issues that pop up, and that puts the provider on a blacklist. I've seen nurses that have gotten in trouble for, um, DME issues, DME referrals that were not looking right. Something from stealing nurses stealing, or any provider really stealing prescription pads and then filling them out. I mean, I've seen some crazy stuff where like caretakers are filling the prescription for patients, and the patient may be dead or they may be alive, and they're skimming pills off the top,
Wow.
or providers getting paid to do scripts for a certain diagnosis for a patient that does not need it, but they're incapacitated. So, what happens to those medications? Well, they get skimmed sometimes, and that's a no no. So, like, there's any number of things that you could get in trouble for. So, don't do it.
I was gonna
It's the
say that's
easy way
that's
to
the
put it.
that's the key there.
Moral of
Don't
the
do it.
story: stop it.
And if obviously if that was the pop up for somebody, I would say, well, don't hire them.
Well, I
Right.
mean, yeah, it stops everything right
Stops the
there because
hiring
you're not.
process.
Yeah, yeah.
It's a
If it
extra.
doesn't, you have a bigger problem, right? Because then
Right.
you're forfeiting your business. So you know what to do.
Yeah. Yeah.
No.
So we've talked about some examples, obviously. Is there any sort of appeals process for exclusions or?
So depending on what it is, you can sometimes appeal it, but it's an expensive process.
Hmm.
I have seen providers get off that list, especially for things like medical marijuana and different things like that, because some of the regulations when medical marijuana was first coming out was rather vague.
Hmm.
And so, you could have genuinely been doing something that you didn't know was not right, and that the defense of ossifer I didn't know actually works there. Not often, mind you, but it's usually once you're on there, you're going to be in trouble for as long as you're paying for different things. And if it's a mandatory exclusion for, a felony, for example, you're done for good.
Mm.
But you'll be in jail anyway, so it won't matter. You obviously you can't see patients while you're
You lose your
asing and while you
license
are,
in the
yeah,
process.
while you are in there. Yeah, you'll lose your license. So there's other things involved where, if you get in trouble in the correct manner, the least of your concerns is getting another job in healthcare.
Sure. No, good point. I mean, and the premise behind this as well is, as a healthcare business is taking these steps and making sure that during the hiring process that you're looking at these things, so you're not hiring somebody that's got some sort of extensive background. And yeah, just
Well, and the problem with this too is that depending on when the background check is run, it's the federal government. So this stuff may not have hit
that's also,
in
yeah.
enough time. So it's one
Do
of
you
those
know
things
the
where
turnaround on that?
it
If
doesn't matter. It doesn't matter. The OIG guidelines are that you check them every year.
sure, sure.
And I believe HIPAA security as well has that same guideline where you
So
got to check them against the blacklist every year.
that was sort of I wanted, obviously for the audience's benefit, how often should you recheck, or do you
Annually,
recheck? Yeah.
I mean, I would say annually. Once you've had the employee for about a 2-year period, you know that nothing's going to pop up by that point. But especially in that first year, things could pop up. And if something does pop up, but you have proof that it didn't pop up at the time that you ran it, yeah, ACA says every 5
5 years.
years is a requirement. But that's the problem, Leanne, is that that's only one alphabet agency, right? So we got to take a look. So it sucks. So I normally run it right before I do annual review.
Mhm.
So I just put it right there in with the annual review. I mean, it takes longer for me to boot up the website and type their name than anything else. It's a quick check. So it's not too even though it's a pain, it's not that bad. All things considered, especially compliance wise. So yeah, I'd say I check it. I mean, especially if you have a question about an employee, I would check it when before you hire them and then within that 90-day period. Because then you can say, hey, I didn't know they were still on probation anyways, and it didn't pop up. You can't be mad at me.
Sure. One of the things I wanted to hit on too, and Jose, just to confirm, you can see my screen. I backed out of the
Yes,
presentation for
yes,
a
yes.
sec, and again, for the audience, part of what we do here at EPICompliance is, we provide compliance tools that give you access to those tools to essentially manage all your compliance in one place. One of those tools that we offer is a Medicare exclusions list document. And ultimately, what it comes down to as well with this stuff, when you're conducting these exclusions, background checks, you want to keep documentation of it as well. Um, our system, we call it the tasking. And essentially, and again, it's just me giving you a long story short, but the way we sort of organize, especially when it comes down to these OIG tasks and stuff like that, we send out to our customers once a month a checklist that sort of highlights, hey, what do you need to focus on for that month? As far as the exclusions go, I believe the way it's set up on EPICompliance now, Jose, I know from a federal standpoint, ideally you want to keep track of it on a yearly basis, but I believe this
Yeah,
EPICompliance.
document it or it didn't happen.
Yeah, exactly, exactly. I mean, documentation is what it's all about, and on the EPICompliance system, it will send out actually a task to remind, or every quarter, to remind you to update your exclusions list or look into it. So I just wanted to show the audience of how it's sort of organized on our system, especially if this is something that's, is especially new to you. Like I said, documentation is key. But you can see here, these are our checklists that go out to our customers once a month. And it's kind of organized by each module of compliance. So you got your OIG task, your HIPAA security, your privacy, your OSHA. As far as the exclusions go, as I mentioned, this was a checklist that we sent out to our customers in March. So one of the task items for this month is verify employee status against the exclusions list or database. So our users can go in here and they can access this document, right? Where again, they can run a check on their staff and they can essentially document that they've run those checks here. This link will take you directly to the database. I'm actually just going to drag it over here. But again, for those that are new to this, this is where you're running those checks. And I'll share this in chat as well. But ultimately, what it comes down to, as Jose mentioned, documentation is what they want to see. If you didn't document, it didn't happen, right? So on EPICompliance, our goal is to make the process and streamline this process for you, where you can simply just document all your employees here, submit it, this document is now stored in a centralized location, right? That can be accessed at any time by yourself if you're the compliance officer of the organization or the business owner. So again, just wanted to show how we make it simple on the EPICompliance system. Jose, we'll go ahead and dive back into the presentation
Yeah.
piece. Anything else that you want to add on the OIG?
So I mean, common sense is a superpower nowadays,
Of
but
course.
you're obviously going to want to do certain you're going to want to be a little bit more specific with certain types of things just because they're touching patients, they're, in charge of prescriptions, so it's one of those details as well where having a clear rubric of all right, we do a background check, we do an OIG check. What are things that we're willing to bypass versus things that were not. So I know some offices that are like, nope, anything pops up, you're out of there. Could be a DUI for all they care, even though it's an office job. It's really
Sure.
just making sure that you have that information set up and that HR is all about making sure that you are make enforcing all of the same rules to everybody, right? So if you go and say, hey, if somebody gets a DUI before they get their job, boom, you're out of there, then is that the same rule for an employee that gets that same thing? So there are certain things that you want to make sure that are in the different policies and procedures and employee handbooks and everybody's trained on just because again, it gets hectic. I know a couple weeks ago we were talking about HIPAA training all the time, and now we're talking about HR, and it's just training, 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 training,
Training
training.
is the
Compliance
source.
is
It's
yeah,
simply put,
compliance
it's
never stops. It never
it's
sleeps.
yes,
So
it's one of
just
those.
picking, you got to prioritize, but prioritize properly. So if there's
Of
things where you
course.
can double dip or triple dip, do it, document it, and then make sure it's in all the separate places because there's nothing against any of that. So
No, and that's kind of why I wanted to spin off and talk a little bit about the training. Obviously when we were talking to Leah last week, she mentioned obviously from an HR perspective, training is very well aligned, in that process, especially with onboarding, with new employees,
yeah,
training. In other words, if you get a new employee, what was the OSHA requirement? You must train that employee, or they must be trained in OSHA. I think within 10 days is the
yeah.
federal requirement. So,
Yeah. So I
um,
mean, it's one of those deals where you want to attach this, yeah, within 10 days.
yeah,
So you want to make sure that you are actually able to meet the requirements that you're looking to follow, right? So the best way to do that is have like a checklist if you're a list kind of person. Or if you're like me, that can be rather disorganized, have somebody that's good at making a list, make a list. And then
of
I
course.
follow said list with new employees. Because if not, what ends up happening is that you could end up having a perfectly good person for the business, but because of your own weaknesses, that employee is in a position to fail. They're not even getting a chance to succeed because we didn't set them up properly.
Right.
And that doesn't reflect well upon management or yourself or anything like that. And if you're one of the people on this kind of, or even looking up this kind of information, it's because you care to do things the right way. So make sure you've got the list. Check it twice, like your Santa Claus, and then go from there, and just go straight down the list. And I know Epi has a lot of these different tools that you can use to have everything all in one place. So that way you don't have to worry about, okay, well, this is over here and that is over here, and my payroll company does this and it's over here and all that stuff. So you want to make sure that whatever tool you're using, that you're consolidating because this has to make your life easier, not harder because ACA's over here, IRS is over there,
Right.
OSHA's over there, HIPAA's over there. It's just you make your life easier, not harder.
I would say, and Jose, you can probably say the same, being in with your healthcare consultant background, but I see a lot of organizations that they try to do the training in house. Like they
Training
yeah,
in house is a
it's
tricky
definitely a
widget.
challenge. It's definitely a
Yeah, it's
challenge.
I mean,
Especially
even
if
for
you're a
myself.
smaller practice. You're a smaller practice and you got low bandwidth. I mean, really what it comes down to at that point is, how often are you doing the training? And I see,
Well,
go ahead.
I'll tell you, I run the practice
Yeah.
day to day.
Yeah.
Before I jumped on this with you, I was on the phone with two of my employees about something. The reality of the matter is that I don't have enough time in the day to create my own training for my own practice, even though I need to do it. I need to leverage other businesses and vendors so that way they can do it. And then all I do is follow up behind my employees and say, hey, did you do this? No? Okay, why is that? Do you not have the time or do you not know how? Because I hired you, you're not stupid. You know, right? Like
Right.
most people are not stupid. They are lazy, but not stupid. So we need to make sure that we are showing them, hey, this is why you want to do this, and not just because you want to do this because you want to keep the job, right? You want to do this because of A, B, C, and D. Empower
Sure.
the people, they will surprise you. It's same with patients. Empower patients, you'll be shocked by how much control they take of their own lives when you tell them when they understand certain things about their conditions.
No, good point. And yeah, I think what it comes down to is just establishing a culture around compliance, right? And the training is a centerpiece to that. And what I wanted to showcase as well is how Epi Compliance again makes this easy for the compliance officer, for the business owner. So you're not sitting there, coming up with your own training. And by the way, your staff needs to be trained on an annual basis, so that means, if you're doing things in house, you're also in charge of going in and making sure that you're updating your training,
Yeah.
again, if you're a smaller practice, I'd say it's almost near impossible to manage it that way.
An
Um,
office manager is a fireman 40 hours a week.
yeah. Yep.
And then outside of those 40 hours a week, the office manager has to do everything else that they actually have to do within their job. So that's where
It's
it's
too much.
it's
It's too
yeah,
much.
it's way too
It's
much.
job. I always say it's job security, but again, you don't want to burn yourself out, you know.
Yeah.
And
Yeah.
like I said, there's solutions out there like Epi Compliance that can make these things simple for you, and again, help streamline the process. So, everybody I can see, I'm just sharing our. So
Yeah.
again,
You can see it.
one of the tools that Epi Compliance provides its customers is again we online training. Think of it this way: all your staff members have their own individual access to the system, and their primary responsibility on here is completing this training annually. Now, again, from the HR perspective, obviously the OSHA course needs to be done within 10 days, but again, what we cover here at Epi Compliance is we call it the big four, right? So OSHA, HIPAA security, HIPAA privacy, ACA OIG, Medicare waste, fraud, and abuse. Generally, if you're in healthcare, you're going to need training in each of those areas, right? And we make it simple. Like I said, the user will log in, access their training center. They'll see the courses that are available to them here. Our process is simple. We provide a lecture. It's a voiceover slideshow style presentation. User will go through the lecture in its entirety. Once they get to the end of the lecture, and again, this is not timed. This is, you can completely do this on your own timetable. Um, whatever suits you or whatever you feel the most comfortable with. Once you complete the lecture, it'll prompt you to take a test. It's 10 question test, multiple choice, true or false format. Once the user passes the test, and again, there is a passing grade on this. You can't just take the test and pass.
You can't Christmas
Uh,
tree it, right? Come
yeah,
on.
you can't. We don't make it that easy. I would say if you paid at least semi attention to the lecture, you will pass. Because again, you mentioned earlier, a lot of this stuff is common sense. But like I said, passing score is 7 out of 10 or better. If the user does not pass the first time, again, not the end of the world. You can take the test as many times as you need until you pass. It'll even show you the incorrect answer. So hopefully, if you happen to get the same question again, we're not getting it wrong twice, right? But ultimately, like I said, everything's managed here online in one place. Once the user passes the test, they can claim their certificate. And by the way, the certificate will remain on the customer's account. If you are a compliance officer or a business manager, you will have sort of special access on here where you can keep track of everybody's progress. You can have access to everybody's certificates. But like I said, these are all downloadable PDFs. You can even print out physical copies, which isn't always a bad idea to have a physical copy on hand. But again, this is just an example of the certificate. It's going to have the user's first and last name up top that completed the course, and it's going to list out all the topics that are covered, right? So this is sort of the bread and butter, right? This is what your staff needs to complete on an annual basis. The way we're sort of set up on our system, because ultimately, like I said, it can be challenging to wrangle all your staff to do this again next year, right?
Yeah,
So
definitely.
on our system, we send out reminders to each of the staff members. So again, ultimately, this needs to be done annually. If the user completed the course today, they technically don't have to take it again until this time next year. Our system will start sending out notifications to the user via email to remind the user 60. I think there's one that goes out 60 days before expiration. There's one that goes out 30 days before expiration. And there's one that's the day before expiration of that certificate. And there's one that will go out the day after. So the user is getting hit with these notifications to go in, log in, and update the training. So we do what we can on our end to, again, our goal is to help streamline this process for you. So you're not sitting there spending hours on end coming up with these training programs that we
Yeah,
don't
no,
know,
you don't.
might
No.
not even be effective, right?
Yeah, you
This is
don't.
we have a proven track record with this process. And like I said, ultimately, we're keeping everything in one place for you. These certificates can be accessed at any given time. Again, year in and year out, it's not like we purge this information from our customers after 2024. Again, this information is here to stay. Because believe it or not, Jose, I believe inspectors, they do have the authority, not to say I've seen it often. This is 7 years I've been in this industry. Um, but it's definitely happened. But inspectors can come in and audit retroactively. They can ask for
They
information,
will. Yeah. So Medicare normally runs about 7 years late.
right?
So you're looking at if Medicare is running 7 years late, you're looking probably 20. I think they're going to give everybody a uh an unofficial pass for the COVID era of 2020 and 2021, but anything pre 19, 17, 18, 19, you better have the records for that. Just in case. I mean, normally they're looking at medical records that far back, but they can look at I mean,
Right.
anybody who's been in the industry a while has seen them ask for obnoxious things. Oh, I want to see the training records. Oh, I want to see this. I want to see that. And you'll be like, why? None of that matters for what we were doing. Oh, well, I don't care.
I call
I'm an
that
outside
digging. They're just
agency.
digging and
Show me.
digging and digging.
Yeah,
They're
show
trying to
me.
just get something, right?
Yeah,
So
yeah.
again, on
They're
our
digging.
system, these certificates, they're not going anywhere. And we keep this information on file up to 10 years, which is essentially over the limit. It's overkill. But, like I said, there's no worry. These certificates will always remain here. This screen as well, I just want to, again, as a compliance officer, as an administrator, when it comes down to, again, wrangling your staff to complete these courses annually, again, you have the ability to go in here and keep track of everybody's progress. And this is sort of an overview of that. This is what we call our course reports tab. This is going to list out all of your users by default here, and you'll be able to see the status of the training. You can see where it's due. You can see where it's pending. You can even see if when they're certified, right? And ultimately, we want everybody to be certified. We want everybody to be in the green. But like I said, from a course management standpoint, this reporting mechanism gives you the ability to go in, keep track of your staff's progress. And again, there's no right or wrong to this. We always suggest this, Jose, whenever it's that time of the year to complete these trainings, you sort of just you wrangle the staff together and you stick a deadline on it. Hey, I'm giving you until the end of March to get this training done. So again, it sort of creates that accountability factor. And if you're using a system like EPICompliance, if you're sticking a deadline on it, you can log in here periodically. You can check on users' progress. Let's just say it's day 5 or day 25 of day 30, right? And you want to go in here and check on status of your employees, and you see one employee that they haven't done a single course yet. Well, guess what? You can get with them in person, but our system gives you the ability as well to send them a direct reminder. You can send them what we call a course reminder. It's just going to send them an email to remind them, hey, your course is still overdue, right? So like I said, we give you that functionality, and ultimately we're trying to make this process simple for you guys. So, but anyways, that's my bit on our EPICompliance system. Like I said, if you're doing things in person, doing things in house, highly recommend using a system. It's going to make your life a lot easier. And like I said, we keep these things up to date for you. But anyway, oh, Jose, Jose,
My
you got your right
partner,
hand man with you today.
yeah, he decided that he didn't want to take a long nap today.
That's all good. We're
So,
happy to have him. But Jose, I didn't know if you want to add anything to the training.
so a lot of times we gotta take a look at. I'm one of those. How to put this? I always like to see. How do you get? What, buddy? It's look. It's here, buddy. Oh. So when it comes to employees, all right, you're gonna have to go then if you're gonna freak out. All right. Well, then here. So when it comes to employees leaving, I always like to figure out why they're leaving. Not necessarily because I assume that everybody's a good fit or that I'm perfect, but Donovan, you need to relax. But the reality of the matter is that if there's something institutional on our end that I'm finding, hey, we had 3 employees leave in the last 4 months, 6 months, and they all said the same thing, maybe we need to address it, and that can be institutional. Not everybody's going to be a perfect fit for us, but we want to make sure that we're always onboarding in the same way. So it's a distinct process. You are not ready to get up. So when it comes to the evolving regulations, this is where different podcasts, different how you're collecting your news, different newsletters, different newspapers, articles, whatever the case may be, they can keep you up to date on different things that happen within the federal government's year or within the state year. We're coming up on one of the major times of year right now where in the next month and a half, any of the rules that are going to be submitted for changes that will take effect in September, the open comment time period will occur. I believe it's April 15th. Someone can fact check me on that. But basically the idea is DEA, HHS, pick an alphabet agency says, hey, we're thinking about making this change. They open it up to comment, and then some poor unlucky soul in DC compiles all of that together and says, hey, they say people in the field say this is dumb. Maybe we need to change it to this rather than that. And that's a lot of how you get different changes in the healthcare industry that were proposed in January, February, but then are modified by the time they finally get put into place in September at the beginning of the fiscal year for the federal government and the state government, right? So things like DEA modifications last year for Suboxone, to make it easier for providers to prescribe that. That was done. The idea was January, February was proposed by the DEA, and then April came around and they opened it up for comment. I actually put a comment in saying, hey, if you're gonna do it for Suboxone, why can't you do it for ADHD meds? But that's a whole nother bag of tricks. And then September came around and they came through with the final rule to take place, whenever they say that it takes place, usually January 1st of the following year. So if you're looking to be proactive in regards to certain regulations, that's kind of how you do it. If you're looking to just stay at pace and figure out what's coming down the pipe, because maybe it takes time to put things together, maybe you have to allot a certain amount of money for budgetary reasons, and you have to propose it to a board, and there's a process involved there, then yeah, it helps, because then you have a couple months ahead of time to be like, hey, we have to do this new thing, and it's going to cost us another $300, $5,000, depending on the size of your organization and the level of compliance that you're going to need to follow. So, or even if you have to follow the new rule at all. So kind of just, you want to stay up to date. When it comes to training, I mean, part of it is everybody does these annual trainings, including myself. And I can honestly tell you that I don't remember everything that's on those trainings.
And you don't,
My employees
you don't
don't remember
necessarily
everything that's
have
on
to
those
either,
terms.
right? Obviously, and let's just be real. Let's just say we're dealing with an inspection, right? They're not going to sit there and quiz you on this stuff. It's more so
Not
it's just
gonna
it's just a formality. You want to,
agree.
yeah,
They're going to want to know more about our specifics. So, hey, they may not ask us, hey, that patient health information needs to be stored in a certain way, right? And
sure,
they'll be like, yeah, okay. Well, what's your standard operating procedure for that in this office, in this organization?
right,
So it may be
right.
that once they take the test, you don't give them a refresher, but you say, hey guys, let's go over how we do things in this office. 30 days later, 60 days later, hey, I just want to take 10 minutes. This is the modification that we're making for, whatever the case may be, and then you just thank you for your input. Then we just, add that into a couple other different things. So we knock out multiple facets at the same time, so it just kind of depends on how you want to structure that, what your setup is, how many of your employees are in one location, is everybody all in the one location, so on and so forth. So
Well, the beauty about the EPICompliance system is, if you're a multi-location business or even multi-entity, very scalable system, everything can essentially be set up under one portal. And obviously from a management standpoint, that's that's easy on them, right? Because
absolutely.
the idea is to sort of again centralize what you're doing. I can't tell you how many organizations I've see that hey, I'm doing my OSHA training through my medical waste company, and I'm doing my HIPAA security through my IT company. It's like
Yeah.
it's a lot of different logins, right? And
So
ultimately,
it's not only just the different logins, but I see a lot of payroll companies that do certain
yes,
aspects of HR training or certain OSHA training. Will always ask the question of what's in it for them as to why they're doing it. So a lot of payroll companies will have annual training,
hmm,
but because they're for a lot of different industries, they'll only focus on the part that is important to them, which tends to be the basic IRS, OSHA kinds of annual trainings. If it's an IT, yeah, they may be doing
HIPAA
HIPAA
security,
security
not
training,
HIPAA privacy.
but they're only going to focus on the technical side, or they're
Sure.
going to more focus on the technical side. So always ask the question of, hey, what is covered here? Is everything covered, or are we only covering a certain portion of it? So because I run into that constantly out in the field.
Always, always. Um, yeah, no, that and like I said, that's the goal of Epi Compliance solution is providing all the compliance in one place and making it all encompassing for our customers. Because, like I said, the goal is just make this process. Compliance is not fun, right? We've said this, we've said this several different webinars at this point, but it's not a fun subject. But it's not going anywhere, right? It's forever
Yeah.
evolving, forever changing, and obviously, as a healthcare business, you got to have it. So, like I said, our goal: streamline it for you, make it simple, keep things in one place, so that you can, uh, you know, see see patients and run the business and keep it simple. So, but no, I appreciate your time, Jose, and I just wanted to open up for the audience just a quick Q&A. If you guys have any questions, concerns, just let us know, and feel free to
Carol,
chime in.
I'm
And
waiting
Dan,
for your answer. I don't know if Carol's still in here, but I know that Carol asked a question about a Washington privacy law. I'm not in Washington State, so if it's Washington State, I'd have to take a look specifically uh at what that privacy law would entail. So if you want, I could take a look at it and get back with you on that. If you're talking about the My Health, My Data Act, is if that's what you're talking about, just put a one in the chat and I'll get you. I'll take a look at it and send you some. Okay, cool. Yeah, I'll take a look at it. That's Washington State. So for Carol, I
it's
know you're in Florida. What do you care about Washington State?
what is it? My health. I'm gonna look into it as myself.
My Health, My Data.
My Data
It's a
Act.
privacy act. So
That's a
I'll take a look
Washington
more
State. You
into
said.
it. It went into effect, looks like early summer of last year. So I'll take a look and see what's going on there. Oh, okay. All right. I'll take a
Uh,
look at it down there and then Carol, and expect an email from me between later today and tomorrow morning. So Yep. Any other questions?
Danielle, sorry we had missed you earlier. For these particular webinars, there's no certificate issued. Unfortunately, I don't know if you're a student, but if you are a student, I do recommend taking advantage of our training program. I'm not sure if you're a South University student or perhaps a Rocky Mountain student, but we do get a ton of healthcare students that require compliance training as part of their curriculum. There will be an email that will be going out to all the participants that will have links to that training program as well. So,
Okay.
gotcha. Well, hey, I appreciate your participation, Danielle. Thank you.
And Danielle, in there, I know that EPICompliance has set it up sometimes to where if they're working with a school, the
Yes.
school will be the client of EPICompliance, and the students will be logins. So then you can just pull them from the admin side, or they can pull it themselves and just send it to you, or send it to whoever you wish.
Yeah,
So
that is correct.
I'm
We handle a multitude of universities, and like I said, some do things a little different, but the preferred method is, as Jose mentioned, you create an account under the university, and then you sort of have the ability to manage your students. So if that's something that you're interested in, like I said, we'll certainly be sending some correspondence out to you, and we can certainly look into discussing the same.
Oh,
Leanne, I
guys.
appreciate it.
Well, I'm gonna jet and get this guy a snack because I don't know if you guys can tell, but he's still half asleep.
Hey, he did well today.
So
But,
yeah, he
well,
did. He's definitely done better, but we'll work on it,
everyone, as
buddy.
always, we appreciate your time. Jose, again, appreciate you being on this one. And next
Definitely.
week's webinar, we're going to be talking a little bit more on the business associate management side of things. I know this was a topic that we've discussed in the past, but what I would like to showcase to you guys is sort of how this is managed through our EPICompliance portal and keeping track of these agreements. So stay tuned for that. You guys will be receiving, as I mentioned, some correspondence, and you will be receiving a registration link for the next week's webinar as well. So hope to see everybody on there. Again, appreciate your guys' time. I hope you found this webinar valuable. If you guys have any feedback, have any questions, or would like to get in touch with Jose or myself, please feel free to reach out. As I mentioned, there will be some correspondence going out here very shortly. Thank you so much, guys. And Jose, as always, appreciate you.
Have a good one, man. Stay out of trouble.
Yep, you as well. Donovan, you especially. Take care, Jose.
Take care.